Here we are again, back in Birmingham for the 2015 National Optical Conference, bringing together all of the LOCs across England and lots of other stakeholders in the eye health sector. It's been absolutely fantastic. We have been really impressed by the presentations, by the quality of the workshops. On day one, we were very privileged to open the conference with a presentation from the President of the Royal College of Ophthalmologists, and that really set the scene for our discussions around the acute sector and primary care working much more closely together.
Some people are working in different places with different relationships with different people in different areas, but we can learn from each other, and that is one of the most important things that we need to do.
Taking that through the day, we heard a lot about new models of care and real examples of where things are really changing.
There's a new care pathway that allows for optometrists to refer directly into neurosciences where visual field defects strongly suggest tumour. Now you can imagine this is going to be a bit of a slow burner. We don't see them every day. But the group are also working together to look to support speedier access into the stroke pathway.
Day two, the big story is data and big data, lots of it. We've had a fantastic group of presenters this morning from ophthalmology and optometry, really looking at how useful data is, but also more innovative ways of collecting it and how we can use it to support the future delivery of services for patients. And ultimately, that's what we're all here for.
So that's the National Data Repository for you. It will support the commissioning of services and provide evidence to maintain existing services.
Delegates have arrived at the NOC really because they want to make change happen, and so they're very positive when they're here because they hear experiences of others, and where they may be getting held up a little bit on their own patch, then it does give them the motivation to keep going because they can see that eventually common sense does prevail.
It's worth remembering that you don't need to be part of a wider programme of change or a nationally supported programme of change to be delivering new care models.
One of the key bits of feedback, certainly at least for the last 3 years, has been that people have really valued the networking opportunities, and in fact we then changed the structure of the morning's networking sessions to bring people together in groups, so groups that are around specific roles. So that might be LOC chairs, it might be people who are providing the governance lead role in their area, because by just chatting to people about little nuances of how you dealt with that thing, that face-to-face interaction is second to none really, so it gives us value to the conference and a reason for bringing everybody out. Next year's conference, we're back here again in Birmingham, so 3 years in a row, and what I would like to be able to do next year is to look at some of the ideas that we've talked about yesterday in the new care models and things that are in their very early stages, and be able to come back and say, do you know what, we've actually cracked this thing in a few places. We've actually got real evidence now that these things that we're setting up in partnership with the Acute Trust are starting to work. And some of the data collection platforms will be able to bring back the real evidence from it, even looking at how the ophthalmology projects are going, the College of Optometrists review of enhanced services, that data will be published by then. So we kind of moving on to a different level. That's what we're hoping for next year.